Welcome. If you're listening to this, chances are you care about staying active, or you've had a recent reminder of how quickly that can change, often due to pain. Most people don't see it coming. They're coping, carrying on, and doing what they've always done, until one ordinary moment becomes one step too far.
Welcome to the 3 Rules to Stay Active for Life. I'm Gavin Routledge, a lifestyle medicine professional, osteopath and author. And in this podcast, I'll share a few simple frameworks to help you suffer less pain and feel more confident about your current and future health. Most people expect to slow down with age. They don't realise how much control they actually have. One of the most common things I hear in clinic is, well, I suppose at my age I can't expect to be as able as I used to be. Or, I can't expect to play as many holes of golf. I can't expect to play as much tennis. You can fill in the blanks. There's this expectation of decline as we get older. Well, here's the good news. Decline is not inevitable. Despite what many, in fact most people assume, and despite the messaging we hear all the time, like, oh, be careful, don't expect to do what you used to do, you're getting older now. Now, I'm not saying you should throw caution to the wind, but what I am saying, and this links back to one of our foundational ideas, is that the story you tell yourself becomes self-defining. Remember the 5th essential practice? Relate. If you tell yourself, well, I'm getting older now, so I can't really expect to do those things, then over time that becomes true. You have written your own script. You slowly do less, you slowly stiffen up, you slowly lose capacity. And that links to another idea you'll hear me repeat often, the first rule. Use it or lose it, but don't abuse it. Now, the don't abuse it part does matter. I'm not saying ignore pain or push through things that clearly aggravate things. But if you don't use your body, you will lose the capacity you once had. And what I've seen over many years in the clinic is that slowing down is not as inevitable as most people think. Now, to be fair, across the population as a whole, we do get weaker with age. We get stiffer, we lose fitness, we get more aches and pains. That is the reality. Most people probably reach their physiological peak somewhere in their 20s, around 25. And if you're in your 20s listening to this, don't tune out. If you're lucky, you'll get older too. And the earlier you start preparing for that, the better. And if, like me, you're already well past 50, this won't surprise you to hear. After about 50, strength tends to fall by around 10 to 15% per decade if nothing is done. Let's put that into something relatable. If at 50 you could comfortably lift a 20 kilogram suitcase, by 60 that might feel like 18 kilograms, and by 70 closer to 16, and so on. We lose muscle with age. We lose strength with age. Some research suggests that leg strength can fall several percent each year after midlife if it isn't trained. And that's one of the reasons people suddenly notice that stairs feel harder, hills feel harder, getting out of a chair feels harder. With age, we lose some of the fast twitch muscle fibers that give us strength and power. We've got different types of muscle fibers, slow twitch, fast twitch. You definitely will lose those fast twitch ones if you don't lose them, because remember, use it or lose it. If you don't use them, the body has no reason to keep them. Another important measure of physical capacity is what's called VO2 max. In simple terms, it's a measure of how much oxygen your body can use to produce energy. In other words, how fit you are. And that tends to fall steadily with age, but the rate of decline varies enormously depending on how active you stay. Bone density also tends to fall later in life. My own mum, now in her late 80s, has had several osteoporotic fractures in her spine, and they can be very painful. Bone density can fall by 1 or 2% a year in later life, but again, the right kind of exercise and nutrition can slow that decline, and in some cases even improve bone strength as you age. A sedentary lifestyle is one of the biggest drivers of loss of physical capacity. So yes, aging happens. We lose strength, we lose fitness, we lose bone mass, we lose resilience. But the pace of that decline is not fixed. It is not predetermined. The trajectory of aging is influenced massively by what you do day to day. And this is where the cliff of health comes in. Now, if you don't know the cliff model, go back to the earlier foundational episode. I think it's around episode 4 where I explain it properly. But the key idea is this. Symptoms often seem to come on suddenly. You wake up one day with pain or stiffness, loss of confidence that comes with it, and it feels like it happened overnight. But in reality, you've been drifting towards the edge of the cliff for months, sometimes years, and then something small often pushes you over the edge. But the important thing to remember is this: nothing stands still in nature. You're either moving away from the edge or you're moving towards it. And many people don't realize which direction they're going because they're not measuring anything that really matters. We see this all the time in the clinic. Let me give you one example. I can't use his real name, but I'll call him Ronald. Ronald was 77 when he first came to see me. He'd had about a year of persistent low back pain, but that wasn't actually the main reason he came in. He had a very stiff and painful knee that was stopping him walking properly. He wasn't a big walker, he wasn't a recreational walker. It was just his way of getting around, and it had become increasingly difficult and painful. He tried painkillers, anti-inflammatories, the usual things, but with little effect. When we assessed him fully, we found his knee movement was very limited. He could only bend it to about 90 degrees, and that was painful. But when we measured everything else, we found more than just a knee problem. His balance wasn't great. His leg strength was poor. His general fitness was low. And those things together are very predictive of falls, and falls in older age can be serious. A hip fracture, a hospital stay, complications. The risk after a serious fall is much higher than most people realize. So we measured his capacities properly, and then we worked on improving them. We worked on strength, we worked on balance, we worked on movement, we adjusted his activity levels, we looked at his recovery and capacity for load bearing. And less than a year later, Ronald was walking, in fact within 3 months he was walking without a stick, but less than a year later his knee was far, far better. He was up to 120 degrees of flexion bending capacity. His balance was better, his strength was better. His fitness overall was much better. And he was doing things he hadn't done for years. Not because he was special, not because he was lucky, because we measured where he was and then consistently worked with him to help him move back from the edge. And that's the key point. Decline is not inevitable. Most people don't do this, partly because they assume that decline is normal. Partly because they're busy, partly because maybe they're tired, partly because they just never stop to measure where they actually are. And if you don't measure, you guess. And guessing is usually wrong. Here at ActiveX, we measure strength, balance, fitness, and lifestyle factors using what we call the Active for Life Index. It's a simple battery of tests that gives a very good indication of where you are on that cliff of health. Because you can't manage what you don't measure. And the encouraging thing is that improvement is possible much later in life than most people think. There was a study in Australia called the Lift More study, looking at postmenopausal women with low bone density. With the right kind of strength training, their bone strength actually improved, even though they were older at the end of the study than at the beginning. We know from many studies that strength can improve, fitness can improve, balance can improve, pain risk can reduce, even in people in their 70s and 80s. So the whole idea of momentum is not waiting until something goes wrong. It's measuring, adjusting, and continuing to take steps back from the edge. Now, before I wrap up, I want you to think about a few questions. Are there things you used to do that you've stopped doing? When did you last test your physical capacity? What would you like to still be able to do in 5 or 10 years' time? And if you're really honest with yourself, are you moving away from the edge or towards it? I'll speak to you next time. If today's episode sparked a shift in how you think about your body or your health, don't try to change everything at once. Choose one small action this week, something that nudges you towards staying active rather than avoiding discomfort. That's how confidence is rebuilt. You'll find further episodes exploring the 3 rules and the habits that matter most, not by doing more, but by doing things better. This program is provided for general information only and should not be taken as medical advice. If you have persistent or worsening symptoms, please seek appropriate medical guidance.